This is Listen Lakeland, the show that keeps you up to date on all things happening in and around the Lakeland area. Here's your chance to plan your family activities and learn more about what your city government and your neighbors are doing to make Lakeland a great place to live, work, and play.
Thank you for joining us today for the May edition of the Listen Lakeland radio show. I'm Ileana Kniss with Lakeland Vision, and just a quick disclaimer, I am also with Peace River Center, and my guest today is Peace River Center's COO. So, today's show will feature Mental Health Awareness Month. Mental health issues are more and more being brought to light today. So I reached out to Candace to see what we as a community can do to increase awareness and help others as we fight to destigmatize mental illness. So joining me today is Candace Barnes, like I said, COO of Peace River Center. And Candace has been with Peace River Center for 14 years and will share her knowledge on how to create acceptance and how to start the conversation with friends, colleagues, and loved ones. So welcome, Candace. Please tell us a little bit about yourself.
Well, thank you for having me today. It's my privilege to be here with you. I just absolutely love to be a representative of Peace River Center because I believe in community mental health and community mental health work. So I started in this field about 15 years ago as a volunteer at Peace River Center's Victim Services Program. And I did presentations and I vacuumed floors and I got to get some training, and I fell in love with community mental health and victim services work. So I have been with Peace River Center for 14 years as an employee, and I've done some work in the victim services world. I've done school-based therapy, and I've done work with kids, and I have done work with adults, and everything in between up to now at this point where I am the Chief Operating Officer. So I'm a licensed mental health counselor by trade, and so that kind of colors my view on the world, and I love the opportunity to talk about mental health and its impact in our community and to add anything to that conversation because it is something that impacts every part of our lives, whether or not we always realize it. And if you think about it, 1 in 5 children and adults experience some sort of mental health condition in any given year. So that's just the individual experiencing the issue. And then you've got family members and friends who are impacted by that. So it's just such a vital part of our everyday lives. So every year in May, Peace River Center engages in awareness building activities during Mental Health Awareness Month. And this year's theme is Make It Okay. And Make It Okay is a community campaign that is aimed at reducing stigma by increasing the understanding and creating caring conversations about mental illness.
Very good. So that's exciting. I love that you've been with Peace River Center for 14 years and have kind of grown your way up to this COO position. So congratulations with that.
Well, thank you.
So I know, as Make It Okay, we're going to talk about stigma. And so over the years, I'm sure that you have seen how stigma impacts individuals. As a community mental health organization, you're seeing a wide range of individuals. And so what would you say is the biggest challenge with stigma?
Well, I think that just to the general impact it has on your community, whether that's the broader community or your circle of support, because it just colors everybody's viewpoint of what you should do, how you should handle a situation, or how you should respond if you are having some sort of symptoms of mental illness. And I kind of, a good example of this is a local survey that was conducted recently. And it asked the question of respondents if they believed seeing a therapist was a sign of weakness. And 47% of people who responded said they thought it was a sign of weakness. And that's kind of telling because in our society, there was a lot of things going on right now. We've had an extraordinarily tough year. And people really need to feel like it's okay to reach out for help and that there's nothing wrong with that. It's a sign of strength when we ask for help when we need it. So the intent behind our Make It Okay campaign is really simple. We just really want to get across the message that it is okay to talk about mental illness. It's okay to have a mental illness. It's okay to get support for a mental illness. And it's okay to love a person with mental illness. But what's not okay is to not do anything.
That's such a great point. And I think that sometimes we think that, again, I think this is part of the stigma of mental illness. See that if we go see a therapist, oh my goodness, we might be diagnosed with a mental illness. And what might that mean for us, right? But I think that sometimes it's not necessarily having to be diagnosed with a mental illness. It's just reaching out so you don't get to a point where, maybe that's the prevention, that you are getting access to care ahead of an illness, right?
Sure.
So, yeah, I think that is great to hear you say, it's not okay to just not do anything. We want people to make sure that they're accessing care or just talking to someone, no diagnosis, no anything, just get the emotional and the emotional stability that you might need for, your current situation.
Sure. And we all kind of exist on a day-to-day basis, kind of on a continuum, right? Some days we feel like we have it all together, and other days, whether by things going on internally or externally, we feel a little bit less like we have it together. And when you're looking at mental health and mental well-being, it's when it gets to that kind of end of the pendulum or the continuum where it just doesn't feel like it's manageable anymore. It's really great idea to reach out to someone and to check in and figure out what's going on with yourself and what are the things that you can do to help yourself be resilient. Well, there's lots of things that anybody can do to kind of start and engage in that process. But really, just when we think about stigma, I mean, that word is thrown around so much, but really just simply put, it's a negative perception that causes someone to devalue or think less of a person. And there's just really some simple ways that you can start to change those thoughts. And the first one is to just learn, educate yourself. There's so much good research out there and good information that's broken down into ways that are easily digested. You don't have to have a PhD to learn about mental illness and what it's like for somebody whenever they're experiencing that. I think that a really great resource is Mental Health America. If you Google that, they have a great website. They have all kinds of resources and videos and things, people talking about their firsthand experiences and how you can respond and things you can do. NAMI has some really great information, especially for those who are supporting individuals with mental illness. So the first thing I would say is really learn. Don't just go off of things that you've heard or you've heard other people say, but go out there and get some good factual information for yourself. The second is to talk. It's so important to talk openly, to talk compassionately, to have some empathy for someone else and what they're experiencing. And you have to understand that there are things that you really can say to a person who is exhibiting symptoms of distress. And then there are some things that are maybe better to not say. And so, for example, you might not want to say, just deal with it to somebody. But maybe you do say something more along the lines of, I'm here for you whenever you need me. There are resources out there that will teach you just how to respond when someone shares that they're going through something, whether it's depression or anxiety or something else. And another thing you can really do is just share the resources that are available so that people will know that there are places they can get help. And those might be resources like Peace River Center, or they might be support groups that you're aware of. But there are resources out there, and when people engage, they do recover. So it's just important for people to know what's available.
So going back to what you just said, just kind of like, don't just say, just deal with it. But I feel like that goes back to the whole misunderstanding or the survey that you said 47% of the respondents said, seeking therapy was a sign of weakness, and some people say, you can get over it. You can just deal with it. Just move on. But, there are specific times and places where you need someone to really guide you through those thoughts and emotions. Is there anything that you want to say about that?
Sure. So I think that if I had a gaping wound on my body, I probably wouldn't just say, I think it'll get better if I just ignore it. And we do that though with our mental health. We try to, I think a good therapy word is we stuff, just, stuff it away, kind of push it away. And if we can ignore it, maybe we can just keep going and we'll be fine. And other people perpetuate that because there is this idea that if you just have the will, you'll be able to overcome it. And when we're talking about, things that can be very debilitating conditions, there's no amount of will that's just going to overcome something. If you have a medical need, you do need to seek out that assistance to be able to navigate that. And a lot of times you're in uncharted, territories. Something that sometimes people don't think about when we're talking about mental health is there's lots of things that are covered under different kinds of mental illnesses. And some of those are, childhood behaviors that are, hard to manage, and, attention issues and conduct issues. And you'll talk to parents and they'll be very kind of beside themselves because they've parented other children and their general tricks and tips aren't working. It's that same kind of thing. There's no one size fits all in this world. And sometimes you just need that person from the outside to bounce these things off of, to give you a different perspective, because what we've done before might not always work in the future, because we change, our situations change, our circumstances change. So it's absolutely not just something that anybody can just will themselves through. You can will yourself to speak to somebody, and that's great, but that's kind of unfair to expect somebody's medical issues to just resolve themselves.
So that kind of brings me to my next question about, how mental illness is diagnosed. And it's, much like a medical condition, like diabetes, maybe cancer, we have to go through some process to get to that diagnosis. So can you talk a little bit about that?
Sure. So, just like any sickness or disease, a mental health disorder is a medical condition. And it can mean that something in your body isn't working as it should. And there are so many reasons why someone may develop a mental illness. And, they really vary. It could be, adverse experiences. It could be something like a genetic predisposition. It could be exposure to harmful substances before birth, brain chemistry, traumatic brain injury. It could be exposure to some other kind of personal trauma. And any of these things can occur and make someone be more likely to develop a mental health issue. And so to diagnose, you would really do maybe a couple of different things. You might see a doctor to rule out any physical conditions to see if there's anything that is contributing to your mental health. And then you would probably see or meet with a mental health treatment provider, and they would do a psychosocial assessment with you to be able to determine kind of what your history is, what's been going on for you currently, what you're experiencing now, and basically taking some time and effort to get an accurate depiction and maybe diagnosis to help determine what appropriate treatment would be. So quite honestly, the more information you have, the more you'll be prepared to work with your mental health professional in understanding what your symptoms may represent and what you might be able to do to mitigate them.
Yeah, so that's so true. I know that much like some medical conditions can, I guess, would you call it, induce some mental illnesses? I know I've heard with, brain disease or like a traumatic brain injury, or maybe, even after cancer, you might become, have some anxiety, things are being triggered by other medical conditions.
Sure. And some medical conditions can cause, delirium. It can cause behaviors that look like psychosis. There's just so many things that can be going on with us internally that it's just good sometimes to take a holistic approach and just recognize that your mind and your body are connected and one impacts the other. So, checking in with a doctor and also with a mental health professional, those are two very good things to do in tandem whenever things kind of seem to be out of balance. And there are just a lot of things also just having, maybe some chronic medical conditions can usually lead to, depression or other types of issues that are a result of, the fact that you're going through something very difficult for a long period of time.
Absolutely. So I know that, there is some belief out there that mental illnesses are not treatable, right? So I guess that belief still exists out there. And can you talk about the likelihood of recovery of a mental illness?
I think that this is usually a common misperception that mental health conditions aren't treatable, or, there's some level of permanence there. But the reality is that people really have very personal feelings about what it means to have a mental illness. And there can be this sense of hopelessness that surrounds the idea of having a mental illness, because when you're in the depths of that illness, it can be really hard to imagine that things are going to get better. And I think that we all maybe can relate to that a little bit if you've ever been sick. And, if you had the flu for several days, that feeling you get where you just you get in that spot where you're like, I'm never going to feel well again. I think we've maybe all had something similar to that we can kind of identify with. And so if someone is dealing with a mental illness, they can get kind of stuck in that hopeless space of, I don't think I'll ever feel well again. But the truth is, recovery is possible, and mental illnesses are certainly treatable. And just like I said before, there's no one size fits all, right? What my goals in life are probably different than what your goals are, what someone else's are. So what we're going to see as success, or what we're going to see as the road to recovery, are probably going to look different, because we're all different. And I think that we have to remember that too, that sometimes people come up with that belief based on where they think someone should be. And I don't know if you've ever experienced this. Sometimes, our family members and our friends have an idea of where we should be in life and what we should have accomplished. And sometimes we're on the way there and we just haven't quite got there yet. And I think that plays into this as well. But I would say that once treatment begins, most people really do find relief and life does get better. And most mental illnesses can be treated effectively through some combination of, therapy or social supports, sometimes medication or attending to your physical health. And those things together can make an impact. And so sometimes that person, has, complete, I guess the word would be resolution of their symptoms. And some people just see a great reduction in symptoms. And it just really depends, because different issues present differently and have different implications. So, and there are really many resources available to help individuals and families. And the sooner people get treatment, the greater their chances of recovery. And as with any illness, it's better to identify and treat it early before someone becomes seriously ill. There's so much research on, even individuals who have psychosis. If you can intervene and treat them within that window of their first episode, their ability to have more significant, response to treatment is higher. So there's things like that. And I won't pretend like it's easy whenever you are going through the midst of a mental health issue to engage in anything. But there are, resources out there, information for helping you to kind of decide what avenue you want to go. And it can be confusing to access any part of the healthcare system. So I would just encourage someone to ask questions, or if you have someone that is in your corner, and you feel like you can't have them ask questions for you, because that can be, especially when you're in the throes of your, whatever's going on with you in life, can be hard to navigate sometimes.
Yeah, and I just wanted to point out too some key points of that is, again, talking about prevention and not being afraid to seek care if you're experiencing maybe some early signs and symptoms of something. I think that's what's so important is like the likelihood of recovery is higher the earlier you start to treat. So again, by removing any ideals that we might have or negative thoughts about seeking therapy for emotional distress, anxiety, depression, whatever it may be. We really need to hone in on that and make sure people understand that it's okay. And that's why Make It Okay sounds like such a great campaign. I'm very passionate about it. I know you are too, Candace.
Sure. And I think that somebody gave me this example the other week, and I told them I was going to steal it. But, sometimes we're going through something in life, and we're thinking about it a lot. It's taking up a lot of space in our heads. And we have people who are close to us, if we're lucky, and they can tell something is wrong with us. And, sometimes we think like, well, what good is it going to do? If I say this out loud, like it won't change anything. But that feeling when you finally just tell that person, this is what's going on with me, and this is what's been, on my mind, that feeling of release, that feeling of relief that someone has heard you and understands you and knows what you're going through, that is such a big part of therapy and treatment. It's just somebody else seeing you, hearing you, knowing where you're at, being able to help you maybe find some perspective that you were a little bit too close to the situation to get yourself. And that's the basis of what we're talking about here, that it's okay to do that. And I think we've probably all had a similar situation like that when we've had that experience, and sharing with someone did make a difference.
Yeah, that's such a great segue too. Being supportive of someone with a mental illness, right? Again, there's a lot of visions and things that we hear on social media or see on TV about how difficult this and that. But tell us a little bit more about that. How do you support someone who has a diagnosis of a mental illness?
Well, I think that oftentimes people are afraid to say the wrong thing. I don't know if you resonate with that. When someone's telling you something about what's going on with their life and it's a bigger thing, people get really scared that they're going to say the wrong thing. And sometimes that fear can keep you from saying anything. And I would just really encourage you to be willing to listen and really listen, listen without judgment or without jumping to solutions for the person, because chances are you don't have the solution for the person necessarily. They really maybe just need you to listen. Check in, Don't just, hear someone tell you that they've been struggling and say, well, okay, check in with that person. If you're not naturally a person who would think to do that, you can set a reminder on your phone, check in with, so-and-so. It's good to feel like someone's thinking about you and it has you on their mind. And sometimes that really helps somebody feel like they can reach out. Remind the person that you really care. Be patient. This is very hard when you're watching someone and maybe you know that they need help and they're just not ready for that yet. Because sometimes you feel like, I have the answer for you. You should just take the answer I have for you. But people really, they need to get to the place of, wanting to talk to someone or wanting to accept, help or assistance whenever they're ready for it. And just be encouraging. Really, that's so important. That if you're willing to hear someone and not be judgmental and be encouraging, I feel like that just gives someone space to feel like, I can share with you what's going on with me and that's safe.
Absolutely. You do feel such a good relief and release when you finally can share with someone maybe some heaviness that you're having, and having that individual be supportive is always so great. So in coming to a close here soon, what do you think some of the key messages that you want people listening to really take away from this about, the Make It Okay campaign or mental illness, reducing the stigma? What are some key issues that people, or key things, key messages you want people to take away from this?
Sure. Well, the Make It Okay campaign is really about making it okay to talk about these things, that we don't have to hide them, that there's nothing personally wrong with you if you are dealing with a mental illness or situations in your life that have gotten a little bit bigger than you feel like you can handle. And I think it's so important for people to realize that mental illness is not only common, it is a treatable health condition. So if you think about 1 in 5 people in any given year deal with a mental health condition, I'm sure you can think of 10 people, there's 2 people in that group, I'm pretty sure, that are dealing with something related to their mental health. So it's much more common than you would think. And when we're a little bit more open about these things, we start to hear stories that we identify with. And when we, can identify with other people that are dealing with the same thing, it makes us feel much more like we can talk about these things too. I think the other thing that's really important to remember is that stigma can keep people from seeking treatment. The ideas and the opinions of the people around us matter to us most of the time. And because of that, if we talk about individuals with mental illness in a very negative way, or we, participate in portraying people with mental illness, in a very negative light in media and social media, then that people don't want to be identified with that. That stigma will keep them from wanting to seek treatment sometimes because they don't want to be identified like that. And I think we all can understand nobody wants to be identified negatively or to be portrayed in a way that it is not positive. And so I would also say definitely do your own research to increase your understanding. Not people share a lot of opinions in many places, whether it's on social media or just on regular media, things like that. There's a lot of opinion out there, but I would encourage you to engage in facts and information that comes from reputable sources. And when you have that increased understanding, it's great to talk and share with others. Really, reducing stigma can save lives because we're making it okay for people to reach out when they need to. I'd also say it's never too late and absolutely never too early to get help for a mental illness. And there are resources that are available for support. One of them is Peace River Center's Emotional Support and Crisis Line, and that's a crisis hotline that you can call 24 hours a day, and you don't have to just be in crisis. You can just be going through something and need to talk to someone, and that's available, and a counselor can even come out to where you are and talk with you. Those things are available in our community. They're just not widely known about because we don't tend to really seek them out till we're in a position to need the support. And I would just say, Peace River Center and the other, mental health supports in our community, they're here for you. So Peace River Center is a not-for-profit organization, and we do mental health, substance use treatment services, and victim services in Polk, Hardy, and Highlands counties. We have been in our community since the late 40s, and we provide kind of like a wraparound continuum of care. So we provide things like outpatient therapy and medication management, and we have some inpatient programs for when people are in more of a crisis situation. And then we have a lot of community-based programs where we kind of wrap around and provide support for people who have mental health issues and need a higher level of support. We also have victim services programs. We have 2 domestic violence shelters and a rape crisis program for individuals who've experienced, domestic violence or sexual assault. And we also have, a lovely thrift store that we would love to take your donations to, that we provide vouchers to our clients to be able to give them items that they need. So Peace River Center is a community mental health agency.
So if someone listening today would like to access care at Peace River Center, how would they access care?
So the easiest way is to call our Access to Care line, which is 863-248-3311. I also mentioned our crisis hotline a few minutes ago, and that crisis hotline is 863-519-3744, and that is also available 24 hours a day that you can call, and free of charge.
Well, Candace, thank you so much. It was a pleasure talking to you. So thank you all for joining us.
Listen Lakeland is brought to you as a collaborative project between Lakeland Vision, the City of Lakeland, and Hall Communications. It's truly a community working together to provide an exceptional quality of life.